Okay, we can get started. Can everybody hear me okay? I have this as a microphone, so it sounds very loud to me, but I can't tell. Everybody good?
Yeah.
Okay, if you can't hear, just tell me and I don't know if I can speak up much more, but I'll do something. So I'll just introduce myself first. My name is Tate Rubenstein. I am a doctor of acupuncture. I got licensed in New Mexico. I've been coming into Woodland Pond for the past couple of months here, mostly on the health center side, because that's where I kind of started. And then with a few people over here on the independent living side. So this side is obviously a lot easier to kind of book the appointments and do that. Over there, you have to go through the doctor approval and then a few other people. So there's a lot of kind of hoops to jump through. Over here is very simple. So I'll just kind of start out by asking, who's had acupuncture here before? Oh, a lot of people. Okay, good. And you know, I've worked with a lot of different types of populations. I'll go over my whole history in a little bit, but you know, I've seen very good results in these kind of communities. I worked in New Mexico with an assisted living community, you know, and I saw very good results, and it seems to work very well for people. So we're going to go over everything, what we can treat, what it does, prices, cost, all that stuff. But I just wanted to kind of go over everything I brought here, and you guys can come up, I guess, afterwards and grab some promotional material and questions and look at the needles. So basically, my office is in Kingston, where I work primarily. So I brought in a lot of these kind of questionnaires. This is just very basic stuff, acupuncture. In a nutshell, what is acupuncture? I didn't write all these, so it's very generic information. You can probably find a lot of that online too, but you're more than welcome to take these. I have a lot of copies of all of it if you want to just sort of read up a little bit about it on your own. This is my nameplate. Because I went to school in New Mexico, you actually get a doctorate in acupuncture, so you have to do kind of pre-med classes and do all that kind of stuff, which is nice because you come back here and you can use the title, so it helps. I have over here, this is both my bio, okay, so you guys can definitely read that, and then on the other side is just a little pamphlet I put together just for, you know, what acupuncture can treat. It's got my email and my cell phone number on here. So on this side, the independent side, you know, it all goes through you and me. You guys can just email me or text me or call me, you know, with any questions you might have, and then we could book appointments, you know, straight through myself. As of now, I've been coming in Tuesday afternoons and then some Wednesdays. But you know, it's pretty flexible, my schedule. I live in Rhinebeck, so I'm not that far. So if I'm not in my Kingston office, I can definitely come over here. So there is some flexibility to that. Otherwise, on the table, I brought this ear sculpture with me. This is, the ear is a microsystem for the whole body. So there's a lot of points inside the ear. It works very well with, you know, addictions or people who want to lose weight or neurological stuff, things like that. So on here is just a lot of the points that we use, you know, along the ear meridian there. This guy also is got all the points. It's a full acupuncture diagram. So you see the points kind of run through the whole body. They run to the hands and feet. In general, if you've had acupuncture before, you probably know we don't use all these points. We use a select, maybe 10 to 15 points, depending on sort of what the condition is and what's going on. These are my business cards, which also have my number on it and my email. So please take these at the end. And once we're done, we'll do a whole question and answer if anybody has any specific questions you want to talk about. I also brought a few other things here. We brought some needles so you could just sort of see what they look like, very thin. The needles are about as thick as a piece of hair, right? So it's very thin. People don't tend to feel them. It's always a question I get right off the bat is, does it hurt? Because it's needles, but the answer is not really. And if you've had it before, you probably know, or if you've talked to friends or other people who've had it, they can tell you it's very, you know, sometimes you feel it a tiny bit going in, but usually that's it. It shouldn't be anything uncomfortable. We use very thin needles, so it helps with that. I also brought in some of these. These are ear seeds. These are just a little seed. It's a natural seed. It stays in your ear, so it helps with things like, you know, sleeping issues, anxiety, depressions, all this kind of stuff. And it's just something that kind of stays in there, you know, when you can't get a treatment, it's always in there. We work a lot with different kind of herbal medicine as well. And I didn't bring many of them. I haven't been using it here as much because there are some interactions. So because a lot of the population here seems to be on some sort of Western medications, we got to be a little more careful with the herbs. Acupuncture, no problem. I'll go over a few contraindications at the end, but in general, you know, it doesn't have much of a downside. It can only really help. There's not much liability to it. Okay, so I'll go over kind of what I have here. So, just a little bit about me. As I mentioned, I'm from Woodstock, New York. I actually grew up here. I lived out west in New Mexico for about 10 years. That's where my wife is from. We have 2 little kids. I have 2 daughters, ages 6 and 10 right now, so they're both in the Rhinebeck School District. As I mentioned before, my main office is in Kingston at the Healing Arts Center. It's owned by a woman, Melanie Shee, and there's about 3 or 4 practitioners. We have a whole front desk crew. Over there, we deal almost exclusively with insurance. We have a contract with the Orthopedic Associates, so they send us a lot of people who come in for hip and knee replacements. So we can talk a little bit about pricing structure here and insurance, which I'm not taking here at the moment, but it's definitely a possibility down the road, because I know some of the Medicare Advantage plans do cover acupuncture now. So that's something we can kind of chat about as we move forward. How I got to Woodland Pond is because my grandmother lived here. She passed away a little less than a year ago at the age of 98, so she lived a pretty good long life. When she first came here, she was on this independent living side. So I used to, bring the kids over. We would go eat lunch over here. It was very nice. And then she took a fall and had a fracture in the hip and slowly kind of made her way to the health center side. And then COVID hit, so it was much harder to kind of come. COVID was hard because it didn't allow visitors to come. But when I used to come in, she had had a stroke earlier in her life. And so when I used to come in, I would bring some of the needles, and I would always treat her when I came. And we do a lot of scalp points. The scalp lines correspond with the motor and sensory lines of the body. So we would do a lot of that. I would do a lot of points in her hands. She had very bad osteoarthritis, from years of using it. So the fingers were a little swollen. So we would do a lot of points in the hands. And one thing I always noticed is as soon as I started doing the treatment, especially in the head area, she became very, perked up and really wanted to talk. And she would get back into old stories from her life. And it seemed to just really kind of stimulate her whole personality, I guess, and I would just keep them in for a little bit, and specifically in the hands too, because she had that bad arthritis towards the end of her life. Yes, all right. So again, we used a lot of scalp points, which are very good for things like, stroke or neurological conditions, Parkinson's, MS, all this kind of stuff. It's a format that was created by a New Mexican doctor who actually does what's called brain mapping. He uses certain parts of the brain that correspond with movement and motor skills and things like that. So that's something we do often is scalp points. I became interested in acupuncture as having an athletic background. I played tennis in college, and I was starting to have some shoulder problems, and this was when I was about 20 years old, so I was in very good shape, and they sent me to an orthopedic surgeon who wanted to do surgery on my shoulder. I was not really that into that. I was young, and I didn't want to do that, so I started seeing an acupuncturist and herbalist in New York City. And it really kind of opened my eyes to a much more holistic approach to medicine. So as opposed to just going in for this shoulder pain, he kind of looked at the whole picture and what caused this to happen, your overall general health in your body. Acupuncture in Chinese medicine is a very holistic approach. Western medicine can be a little linear at times where you're just going in for a specific issue. This is kind of looking at the whole picture. I mean, we will treat sort of what the main complaint is, but there's a lot to it. We kind of look at all different areas of the body. So just a little bit about acupuncture. It's an ancient tool. It's been around for over 3,000 years. It either works independently or alongside Western medicine. So the woman who owns my practice in Kingston is a Western doctor. She's a Western physician, but she also practices acupuncture. So it can definitely work, in conjunction with that. So if you have, a doctor or primary care that you're working with often, it's somebody that I can kind of speak to and go back and forth about, treatment plans and what would work best specifically for everybody. So the acupuncture helps to relieve symptoms and signs of many health problems and brings to light more the root cause of the problem. So as opposed to the branch of it, if anybody has pain, that's usually a branch thing. You're trying to find the root of what's causing it, what's going on, below the surface that's leading to this pain. So the acupuncture kind of encourages the body's natural healing process. Our bodies are very good at sort of healing things themselves, but we're very quick to kind of get in the way of that, through what we do, bad habits, medication, pills, all kinds of stuff. So the acupuncture creates a place where your body can actually heal itself. And it works very well from the inside out in that respect. It can strengthen and support the body to help prevent, future illness and disease. Most of my people in my office in Kingston come in on a weekly basis in general, and the idea is they're being very proactive with their health. They don't wait for something to kind of come up before they come. Once things are kind of in your system, it's a lot harder to work with. The idea is to kind of keep everything healthy enough so you can sort of stave off and fight off viruses and infections and all this kind of stuff. So the main tool in acupuncture is obviously the use of these needles, these very thin needles, and you use them in different parts of the body that go along with, either the channel theory or specifically in certain areas. When you put the needle in, it attracts red blood cells to the area, so it helps to kind of oxygenate the blood in the area. So if I came and saw one of you and you had a big, swollen left ankle, I probably wouldn't want a needle directly into that, because you don't want to pull more fluids to an area that's already swollen. What you do in a case like that is you try to figure out what channel it's on and needle away from it to try to pull some of those fluids away. More chronic things like back pain, things that have been going on for a long time, we usually needle directly into, because in that case you do want to sort of bring blood and, let's say, energy to that area. So there's a few different types of treatment principles there. In Chinese medicine, we look at pain in general as a disruption of flow in the body, right, which leads to stagnation, things not moving, which then leads to sort of disease and all different kinds of pathology. So the acupuncture is very good with these inflammatory conditions, which often are the lead cause of, I think, a lot of things that people are dealing with. So what else? Yes, we talked about the proactivity, the body's ability to heal itself. Okay, how does acupuncture affect our bodies? So all points will stimulate the nervous system in the body, and it releases natural chemicals into the body, into the spinal cord, the muscles, and the brain. Things like serotonin and things like this that help with pain in the body. These biochemical changes stimulate our body's natural healing process and the ability to heal itself. That's kind of what I was talking about briefly before. A question I said before I always get is, does it hurt? Is it very uncomfortable? They are needles, but it really doesn't. They're about as thick as your hair. They're very thin. You put them in, you stimulate it a little bit, but generally people do not feel it much. It actually has a very kind of relaxing state. A lot of people fall asleep once the needles get in. We see a lot of things like insomnia and stuff like that, and the needles seem to have a very kind of, effective calming the system. Let's see what else. So what do we do with the treatment? So basically I mentioned I could either come to your rooms here, or we could use the public area, which is in the PT department on the other side. In general, I've been going to people's rooms because it seems to have a good setup for this. I don't tend to bring a table in, but you have a bed there, a couch there, and we could, or even in a chair, whatever's kind of most comfortable, we'll sort of figure that out. So the four main tools that when I come in would be the pulse diagnoses, okay? So we'll feel the pulse. A few things we're looking for there is excess versus deficiency, whether the pulse is very, rapid and excess, and then the idea of the treatment is to reduce. Or if the pulse shows me that things are very deficient, then the idea is to tonify, to bring things up a little bit. You also look at general appearances, the tone of voice, demeanor, the shape of their tongues, just an overall appearance. It's something we do. And then we go over past medical history, asking a lot of questions. Often, when I first see people for the first time, I'll ask for their sort of medical records, and that way I can kind of get an idea of exactly, what we want to work on and what's been going on. And then there's always a physical examination where I'll palpate certain areas of the body, kind of see what feels sore and tender, see sort of what's going on. But a lot of it is talking, and you can kind of just, let me know exactly what's bothering you, how long it's been going on, what makes it better, what makes it worse. It's very nice here at Woodland Pond because it seems like there's a lot of services. I mean, I know you have a pool here, and you have a PT department, and that's why it's great to just add one more service like acupuncture to the community here, because it's really, it'll benefit everybody who tries it, I think. So a few conditions that we can work with. Now, acupuncture can treat a lot of stuff, but some of the stuff I wrote down here, just in particular, digestive tract issues. I see a lot. That's things like IBS or gastritis, irritable bowel syndrome, things that coincide with the digestive tract. Also emotional support, and that's anything from anxiety to depression to insomnia to nervousness. When I work more with those kind of conditions, the treatments are a lot more balanced. There'll be very similar points on both sides of the body, and then a few things in the center just to kind of, center, as the word says, bring things together. I find that when it's neurological things like that, the balance treatment seems to work the best. I mean, if the main complaint is things like hands like that, then we focus on that. But for more neurological stuff, we work very balanced. We also work on eye, ears, nose, and throat, things like allergies, rhinitis, sinusitis, sore throat, COVID-19 recovery. I mean, we're living in a time where I'm sure a lot of people have had or been exposed to COVID, and then sometimes there's these long-term, symptoms and effects. So that's something we can definitely work on too. Allergies works very well. Not so much this time of year because we're already in winter, so they seem to cool out. But in the spring and fall, in my office in Kingston, we see a lot of allergy people coming in. We have all kinds of herbal medication for allergies. I use a lot of points around the sinus cavity to kind of open up the sinus cavity a little bit. Next would be musculoskeletal things like pain management. Everyone's got some kind of pain in their body, back pain, hip pain. The idea is we try to figure out where it's stemming from. A lot of times pain comes from, the gait being a little bit off, the way people are moving, things like that. So we kind of look at all that stuff. Arthritis, I've mentioned it a few times, but osteoarthritis in the hands and feet. When the hands kind of tighten up and clench up, people have trouble lifting things, they lose strength. Works very well with that. Joint pain in general, elbows, knees, any joint in the body, shoulders. One of the main things I see, not as much here as over there, is back pain in general. Low back pain, sciatica, cramping, muscle cramping, weakness, all that kind of stuff. Very common. The spine is very delicate in between each vertebrae. You have nerves. Over time, things become compressed a little bit and the vertebrae starts pressing on those nerves. So that starts sending pain kind of down the leg. That's sciatic pain, which is something very common. So through the treatment, we help to kind of elongate the spine a little bit. You're supposed to have a certain amount of room between each vertebrae. Over time, with gravity, things become compressed. So by working, doing the treatments, we try to elongate the spine, so it creates separation in between each vertebrae, which takes a little bit of that edge off coming down the legs. Neck pain, cervicalgia, things like that, very common, all kinds of neck stuff. Often people complain of headaches, which is often a cervical headache, so it's stemming from the back of the neck. That's something we look at too, migraines, all that kind of things. We sort of see where that's all stemming from. More of the neurological stuff would be headaches and migraines, Parkinson's, MS, post-stroke stuff. That was what I started getting into earlier a little bit, which is a lot of scalp points. So there is a protocol that I use a lot where you needle contralaterally. So if you're having right side paralysis, you needle in the motor side of the left side of the head, put the needles in. While I stimulate them, I have the patient kind of try to move the hand around, move things around a little bit. And it works pretty quick. You see people start to get that movement back almost right away. So that's something else we can definitely look at. Post-operative pain, people who have had surgeries and are still recovering from it, that's something else we can work together just to create, a smooth flow of the body so everything moves a little better. And then I just have like a miscellaneous category here with irritable bladder, proctitis, infertility, addiction, all this kind of stuff. People who want to lose weight, any of these kind of things are things that we can kind of work with. The other thing I have here is hospice care. Hospice is a group I worked with when I was out in New Mexico a little bit, just of overall comfort at the end of life. I mean, that's something that, hospice brings in, but in conjunction with the acupuncture, it can just help to kind of relax the body a little bit. And it supports your other treatment. As I said before, I'm sure a lot of people here are under care of a physician, so we can kind of work in conjunction with that, and we can sort of talk about treatment plans and everything. Most Western doctors are happy to sort of sign off on acupuncture. They think it is very beneficial to the patients. So that's something we could kind of talk about as well. I mentioned contraindications earlier. There isn't many. One thing is blood thinners, which I know some people here might take, things like Coumadin, Morphine, Eliquis, all those blood thinners. You can definitely do the acupuncture with it. I would just use different needles. I use thinner needles. If people have bleeding disorders or are taking high doses of blood thinners, I'll use a very thin needle as to not cause any bruising or bleeding or anything like that. So it is something that is not contraindicated, but it's something we keep an eye on that we're a little more careful with, I guess. The other thing is occasionally, and I don't have it here with me today, we use what's called electric acupuncture. So we take these little alligator clips and you attach them to the needle, and then I have a TENS unit machine and it kind of pulsates. It makes the muscles twitch like this. It works very well with like acute pain and swelling. A real contraindication with that is people who have pacemakers in. So if that's the case, it can kind of set that off a little bit. So that's something we would definitely, talk about. I would get a full list of your medication before we do anything and just make sure, everything is safe and effective. The only side effects you see occasionally are a little soreness, maybe a little bruising. Some people get very tired after the treatment. I have some people that come in, like to get treated at the end of the day because it can make them tired. Some people I get come in during their lunch break. It makes them feel energetic. So that's something we can kind of cater the treatment, whether you're looking to, increase your energy or whether it's something to help you kind of wind down and sleep at night, things like that. Okay. So that's pretty much my whole blurb here, but what I'd love for you guys to do is come up, take a look at some of this material. I can answer any kind of questions you have. In terms of pricing structure, as I mentioned, here I have not started bringing in the insurance yet. All the insurance in my other office goes through a billing department, and I was trying to kind of keep that separate from here and there. Now, insurance is something I can potentially take in the future if your plan does have acupuncture benefits. In general, without the insurance, I charge about $90 for a session. It's about an hour long. I come to your room, we go over the whole case, we talk about things. The treatment's about 35 to 40 minutes with the needles in, but in total it's about an hour. I've also been doing like some package deals for $800 I was doing 10 treatments just to make the cost a little cheaper if you know you want them. And those are good for, as long as you want a year or so. I'm pretty loose with that. So those are some options in terms of, when I come in, how much it would cost, everything like that. Is there any questions anybody has about acupuncture in general, or how it could help you, or we can talk more individually as well? Anybody? Yes, please.
I had a few years ago, and afterwards, it made me feel so happy.
Okay.
Like, for about 20 minutes.
Yeah.
I'm 20 years old.
Yeah, people say they get acu-stoned. It's like a little bit, they get this like kind of euphoric, lightheaded feel. Yeah, I see that a lot, because especially when you work very balanced in the body, it does sort of create this sort of, euphoria, a good feeling. Yeah, it's true. So that's I see that a lot. That's a little different than specific pain management, because that we would work more specifically in certain areas, but I certainly see that often. Yeah, please.
Help with carpal tunnel.
Yeah, carpal tunnel. So that's another thing in the hands. Generally, that stems from the median nerve, which is right in here, and it does help. I mean, carpal tunnel is usually caused from repetitive motion, maybe typing for a long time, or knitting, or sewing, or whatever you're doing over and over again. So it is something we can work with, especially the symptoms of it, which tend to be hand pain, hand locking, lack of strength, and things like this.
I was told I have carpal tunnel, but the only time I feel it is I wake up a couple of times at night with my arm going numb.
Numbness, yeah.
And my fingers burning. Doesn't happen at all in the daytime.
So to me, it's possible carpal tunnel. It could also be something stemming from the cervical vertebrae. It sounds like that's a little nervy, right? Like when you describe the numbness and tingling.
Yeah.
It sounds like a nerve. It's possible during the day because you're moving around and your hands are moving, so things are kind of flowing correctly. And when you're sleeping at night, everything is sort of stagnant. And so when you wake up, it kind of makes sense that it would take a little while to kind of get the blood flowing and things moving. It could potentially be carpal tunnel too, but to me that sounds a little nervy, the way you're describing it.
But acupuncture would help with that?
Absolutely, for sure. And like I said, we can work, face down, where we're working more on the back of the body, or face up, where we're working on the front of the body. We treat people on their sides often. We really cater to make sure that, the patient is comfortable, so that, you don't want to tense up, you want to be comfortable, and that's how it sort of works the best. Often acupuncture is subtle, and you might not, immediately notice all the changes, but over time, you'll see it'll just kind of create this place in your body where things just feel better. I mean, being proactive, as I said, with your health, I think is very important. I often see people who are pumping regularly, and then all of a sudden they stop for a while. And then when they come back, they started to notice, by not coming for a little bit, what was happening. You don't notice the effect of it when you're doing it weekly maybe, but when you stop, you start to see sort of all these issues sort of coming back to life, so to speak. So I think it's good to stay on top of it. Even if you don't have a main complaint right off the bat, we can work on a whole bunch of stuff. I'm sure everyone's got, something to work on. Anybody else? Any other questions? Concerns? Anything? Yeah, please. Sorry, one at a time.
I had a number of treatments, and I felt very flexible after, much more than I had before.
Good.
I went in.
Yeah, I think that kind of addresses back to just the overall, stagnation too. I think when things are not flowing correctly, you feel weaker, you're not able to move as much. So if you can get that kind of free flow, things just sort of open up. It opens up those channels. That's also why when you're describing that kind of euphoric feeling, same thing. It just kind of opens everything up for you. So as I said, I don't see many negative effects to the acupuncture. Certain types of treatments, chiropractic, certain things can actually cause a little, issues if not done correctly. Acupuncture does not, my medical liability insurance is very low because there's not that much that can go wrong. It's really only can really help you out, so it's nice in that respect. I think someone else, yeah.
Yes, Tiger Bomb.
This one.
You have it there, yeah.
Similar, a little different, but similar.
Is that Tiger Balm?
No, this is actually, this one's called Postuman oil. A very similar idea. It does heat up on the skin. We have Tiger Balm too. I just had this one in my bag, so I brought it out.
Do you use it in conjunction with the acupuncture?
I do. So often what I'll do at the end of the treatment is use a liniment, maybe not that one because that one's very waxy, that's for like a small area, but I'd use one that's more sort of lotion based, and I use what's a scraping tool. It's called gua sha, that's the Chinese name for it. I don't have one with me, but they look like a flat, like porcelain black thing, and you just sort of scrape it over the skin. Some of you might be aware of what that looks like. They used to use in the olden days those porcelain Chinese soup spoons to do this. Now I have a tool that we use for it. So we would put the liniment on the area and we kind of scrape it, going one direction so the blood and stagnation sort of disperses. You don't want to kind of go back and forth. So that is something we use, these liniments. I have those ear seeds there. I have, like I mentioned earlier, a lot of different herbs, both topical and internal. So that's something, you know, we can talk about as we move forward and kind of get to know you guys individually. Yes, please.
Sometimes at night my legs just ache.
Mm-hmm.
I either have to move them a lot or get up and take Tylenol or something.
Like a restless leg kind of feeling?
I don't know if it's restless leg, but they just hurt.
So often that kind of stuff, cramping and leg pain at night, restless leg stuff, is often like a potassium or magnesium sort of deficiency in the body. So, you know, I would want to look over sort of what you're already doing, but I always recommend magnesium citrate for muscles at night. Magnesium citrate actually helps you sleep through the night. It's a muscle relaxer, so it helps with that kind of stuff. A lot of people I see who have restless legs, which I'm not sure if that's what you're describing, I say to take a bite of a banana or something before bed, or stay hydrated throughout the day. Dehydration can also cause that kind of muscle cramping, but magnesium citrate is a good one to kind of add in at night. Just take one pill a night, and I think it'll help you sleep a little more comfortably. Yeah. Anybody else? Good. So if there's no more questions, you know, I invite you guys all to come up and we can kind of chat individually. You can definitely take some pamphlets. The best way to get in touch with me is, you know, you could call, but email is usually pretty good, and that way I have it all kind of in record. I have a computer software that I can create invoices for you. Sometimes you can actually submit to your insurance yourself. You would lay out the payment, and then I can give you what's called a super bill, so it has all the coding and everything on it, and you can submit it for reimbursement to your insurance company if that's something you're interested in. As I said, I will start incorporating the insurance here as we move forward, as more people kind of sign on, if that seems like something that sort of people are looking to use more of, which I'm sure they are. We can definitely add that in. I'm just trying to figure out, I have what's called an NPI number, which is a National Provider ID number. My NPI number is associated with my office in Kingston right now, so I got to just talk to them about how to kind of merge it over here. But it's something we could definitely talk about as we move forward. Yeah, and thank you very much for having me. I'm here, you know, like I said, I'm pretty flexible. Right now I'm here Tuesday afternoons and Wednesday mornings. But I am flexible and I can come other times and we can kind of, you know, chat up here if you have any other specific questions for me.
Thank you.
Yeah, thank you guys. Okay, you know, please come on up and you grab some of this material here.
The vast majority. So it's in your book.
I'll show you.